Today I'll be presenting on my thesis where I decided to research the influences of race on maternal health. Through the course of the presentation, I will 1, give an overview over the motivators and where my research questions stemmed from. 2, I will give a brief overview of the existing literature, the previous research, and where the gap lies. 3rd, I will go over the methodology and how I collected and analyzed my data. And lastly, I will go over what the major emerging themes were. The first factor that influenced me to conduct this research was my family. There are many women in my family who have had difficult pregnancies, which has negatively affected either the health of the mother or the baby. I grew up questioning whether these troubles in their health were consequences of mere genetics or larger societal fails. This question became even more pressing once I recognized similar patterns arising in other families of color. The evidence that this was a problem that other families were facing eliminated the possible solution that it was mere genetics. Moreover, I have seen these women struggle to advocate for themselves without the support of their provider. In addition, at the time I started this project, the political climate was very tumultuous. In a time of Black Lives Matter, I found myself coming across increasingly more stories of Black women being neglected during their pregnancies. I think some of the most famous cases were Serena Williams and Beyonce Knowles. I did a quick search and I discovered that Black women are 3 to 4 times more likely to die due to pregnancy complications than their white counterparts. This ultimately led me to my question. How do Black women make sense of their experiences and interactions within maternal health care? As I was reviewing the existing literature, it became clear that the history of mistreatment of Black women within the healthcare system started in the 1800s, when medical physicians such as Jason Marins and Nathan Bozeman operated on enslaved women without their consent. Black women had to endure the operations and experimentations without the use of anesthesia and had to endure unmeasurable pain. These Black women were mutilated and tortured for the sake of science. Instead of being ridiculed for unethical practices, Sims is accredited as being the father of gynecology. Enslaved women were not thought to be people, but objects used either to increase their slaveholders' economic stakes by reproducing more children, or by being degraded for the purposes of providing answers about the reproductive bodies of white women. In 1835, a 35-year-old enslaved woman who had a history of miscarriages was only able to carry out 1 child to term. The doctors at the time decided to perform experimental surgery to remove a tumor. For her many screams of agony and protest, she was described as unruly and lacking decorum because her surgeons were burdened by trying to restrain her. In the 1900s, laws were introduced that promoted and encouraged the forced sterilization of Black women. Later in time, the sterilization of Black women was advertised to combat poverty. The decrease in the number of Black babies would decrease the amount of mothers who depended on welfare programs. These laws and actions were supported by eugenicists who aimed to decrease the reproduction of undesirable genes. Black women were not afforded the decency or acknowledgement of womanhood nor personhood to be able to make choices regarding their own bodies. They did not have the choice during the surgical experimentations that served as the basis of the field of gynecology, nor did they have the choice when they were forced to have sterilizations. Secondly, there's a lack of Black and brown healthcare providers. Having a doctor who shares the same racial identity allows her patients to trust that their doctor has the best interest in mind. The lack of representation leads to a lack of trust instilled into these institutions by Black and brown people. As a result, these mothers are less likely to be forthcoming about their concerns. Black women have also been erased from the larger women's movement, resulting in Black women spearheading their own reproductive justice movement. This movement was created by Black women to emphasize the importance of female agency over decisions pertaining to her body and her reproductive options before, during, and after pregnancy. This includes issues such as maternal rights, maternal health care, and abortions. Third, the westernization of medicine has continuously made efforts to make birth into an impersonal act. This depersonalization of birth has also made doctors insensitive to the needs of these expecting mothers. Contributing to doctors giving medical advice that is based on the convenience of the doctor instead of the comfort of the mother. This rush production, while efficient in delivering babies, it allows for error. The needs of the mother are failed to be met. In relation to Black mothers, not only are their cries of pain ignored, but they do not get the time to voice their concerns. The process of birth becoming increasingly impersonal and less about the mother makes it easier for doctors to ignore the birthing choices of Black women. Lastly, the literature also points to the role stereotypes play within the care received by Black women. The Black woman is considered to be a medical superbody, which translates to the notion that these mothers are incapable of feeling pain, or they're more tolerable of feeling that pain. Decade-long ideas of Black women taking advantage of welfare programs or being overly promiscuous translates to doctors believing that the pregnant Black women are deserving of their pain. Images such as the welfare mother, which is a Black woman who takes advantage of social welfare programs. She has multiple children who she fails as a mother, serves as a foundation for the sterilization and the use of mechanisms to reduce the amount of children Black women could produce. Despite all the literature written and studies conducted, very few sought to understand disparities within the maternal healthcare system from the mother's perspective. My study allowed for the voices of Black women to be added into the dialogue by allowing them space to talk about the discrimination they face within medical institutions. This was a qualitative study, so I conducted a series of semi-structured interviews with 6 Black women who had become mothers within the past 5 years. I recruited using platforms such as Instagram, Twitter, Facebook, and LinkedIn. In addition, I also shared flyers with various family members, friends, and professors. To be eligible to participate in the study, it was crucial that the woman interviewed identified as Black. Also, I limited the women interviewed to either expecting or current mothers. And current mothers needed to have been pregnant within the last 2 years, and this was later extended to 5. Mothers were also expected to have been physically pregnant to be considered for this study. Their pregnancy did not have to be successful nor carried to full term to participate. Participants were also not restricted to the state of Georgia. These women were asked a series of questions that ranged from how they selected their provider to their mental health during their pregnancies. As mentioned before, I conducted interviews with 6 Black mothers. The ages of the women interviewed ranged from 27 to 39. Some of these women have experienced multiple pregnancies, and some of these pregnancies were not always successful and led to miscarriages. However, as I was coding and analyzing the interviews, there were 2 constant themes that kept emerging. The first of these being agency. The first theme of agency is defined as the amount of control these women had in making decisions regarding their treatment plans during their pregnancy. The level of agency these women felt they had was informed by numerous factors, including their economic status, previous pregnancy experiences, family history, their provider's identity, and how they thought their providers perceived them. When Kavya was asked if she believed her race impacted her care, she said, "I didn't think my opinion was valued. I didn't think that there was any compassion. I've got, at least, all the different layers that you wear to kind of illustrate that you have a different socioeconomic background, so you should treat me a little bit more differently." Kavya expresses that her choices were not accounted for due to her race, but she also includes that she thought that her higher level of income and economic status would allow her opinions to be weighted differently. Her encounter shows that within the healthcare system, that one's socioeconomic status does not relieve them from encountering racial discrimination, which impedes Black women from having agency in their care. But we also see the importance of having providers that are also women and of color, how that empowers them to act out on their agency. As expressed with Amin, who says, "I just really wanted someone that was a woman, and then specifically a Black woman, because someone that can kind of relate and understand what I was going through mentally." Amin wanted a Black provider because she wanted someone who would relate to her experiences and understand where she was coming from. Further, this allowed Amin to be comfortable to express her wishes without fear of ridicule and rejection. She knew that if she was to express her concerns or make a demand about her care plan, that it would be respected. The second prevalent theme was that of support systems. For this study, support systems are defined as external actors that serve to validate and defend the best interests of the mother. Support systems can be the healthcare providers themselves, spouses, partners, friends, and/or parents. As mentioned before, the choices of Black women are not always respected within the medical institution. This was demonstrated by Alexis. Alexis has been pregnant for a total of 3 times and has experienced 1 miscarriage. During her first pregnancy, she knew she wanted a C-section due to her family history, which revealed multiple women in her family experienced medical difficulties giving birth vaginally. When she arrived at the hospital, she was given a doctor who was unfamiliar with her case and history. When describing her experiences, she says, "I got to the hospital and they tried, for several hours trying to induce labor and whatnot, and were pushing for me to try to go into labor rather than listening to what I was trying to suggest and say, hey, this isn't working. This is uncomfortable." So my mom and husband were there to advocate for me to push for a C-section because my body wasn't changing. So that's where it got a little tricky. Alexis needed her mother and husband to advocate on her behalf because her wishes were continuously ignored by the doctor. This doctor neglected and ignored Alexis' birth plan. A birth plan is the desired way the mother wishes to give birth to her child. This is shared with the provider and should be upheld. Prior to conducting these interviews, I thought a birth plan was required and a necessary part of one's pregnancy experience. Sharon, another participant, disagrees. I did not have a birth plan. I did not write one out. A birth plan is something that you need when you need to advocate for yourself. I didn't need to advocate for myself because my preferences were her normal. Sharon chose a midwife instead of the traditional obstetrician. She did not feel the need to have a birth plan because she did not feel she needed to be advocated for herself or her choices. She and her midwife spoke in great detail about every decision and step that would occur in her pregnancy. She trusted her midwife to have her back, in contrast to Alexis, whose birth plan came in handy when her mother and husband needed to advocate on her behalf. In conclusion, I believe more providers need to be aware of the implicit and explicit biases that negatively affect the Black women that they care for. Black women also need to be offered more support from within the medical institution. They should not have to question whether their provider is taking their health or the health of their baby seriously, or that they may die at the result of negligence. Moving forward, I would like to better understand the impact of Black mothers' experiences have on their mental health, and I would like more similar qualitative studies to be conducted on other women and mothers of color. As you can see, while Black women may have the largest number of deaths related to pregnancy, this is a problem that is prevalent in other racial and ethnic groups.